Our healthcare system is in crisis, and I'm not sure how long it's going to last. So make sure to go vote on February 27th for the next Ontario government. I normally don't pay attention to the politics, but yesterday I reviewed the policies regarding healthcare and mental health from major political parties in Ontario, and here's my 2 cents. I'm not sure who I am going to be voting for, but I'd like to share my comments so you understand where I'm coming from. So, all political parties trying to address a few similar issues. Number one, lack of family doctors. Right now, there is more than 2.5 million Ontarians don't have a family doctor. And the primary care providers is a gateway to the healthcare system. So without them, they cannot get referral to see a specialist, they cannot get routine prescriptions, they don't get physical exams, a lot of their concerns do not get addressed on time, then they end up in crisis in emergency rooms, exacerbating the second problem I'm going to mention. The number right now is 2.5 million Ontarians without family doctor, but in a couple of years it's going to almost double to 4.5, and it is going to continue to grow with the population growth and demand. So, second problem is so-called hallway medicine. Right now, there is a huge crisis because many patients are being treated in emergency room hallways because they don't get a room or a bed. Why? Because it is so busy, in part because there are no family doctors, but it is also because there is not enough staff. Some emergency room shut down because of staff shortages. So all major political parties promise to end hallway medicine. The third problem is the staffing issues. So I know in our hospital we don't have enough nurses, and we are in Toronto. If you drive just 1 hour away from Toronto, it is a disaster. The emergency rooms get closed because there are no nurses. In the city, Peterborough, just an hour and a bit away, there is not even single child psychiatrist. We're kind of okay in Toronto, but just an hour drive, there is zero. So people have to drive for hours to get help. So how are the political parties trying to address it? Well, let's start with the leading Conservative Party. They've been in power for a few years, and surprisingly, they keep promising exactly the same thing this time that they promised last time, to end hallway medicine, to end shortage of family doctors. They promise special programs and plans, but why do they still promise the same thing? Because it hasn't been addressed. So their policies did not work, and some people believe that the current government is actually sabotaging the public system to make way for the private medicine. I didn't think so. I thought it was just a token for negotiations, but yesterday I kind of looked into it, and it looks kind of suspicious. Well, one, current government actually underspent money that they had for healthcare. Two, they pay more for private agencies for nurses and private surgical procedures. They pay more than they pay to the hospitals. And the hope was, I suppose, that the private clinics would have some sort of magic and they make nurses and doctors just appear in Ontario from the thin air. But what happened, of course, they just poached the doctors and the nurses from public hospitals, so the wait time in the hospitals got longer, the surgeries became more expensive because they're on a private side now, so the situation actually got worse. In terms of the mental health, the current government actually underspends about 40 to 50%. So the standard is about 10 to 12% on mental health out of the overall healthcare budget. That's how much United Kingdom spends, for example. But Ontario spending less than 7%, that is very small amount comparing to the rest of the medicine and overall budget. So, and we see it on the front lines because I know that in our clinic, we actually cannot accept patients with moderate mental health issues just for counseling alone because we don't have enough social workers. If we had more money, of course, we would have hired more social workers and the situation would have been better. So I don't know who I'm going to be voting for, but I think current government needs to be punished for the lies. So I'm not voting for conservatives. They're not good for healthcare. They're not good for us. Oh, one more thing: when they started the Conservative Party, they actually alienated doctors and nurses. So nurses threatened strikes. The doctors currently in arbitration with the government because the government actually does not pay enough. So they say they need more doctors, but they don't pay enough to the doctors. So, and as a result, despite what they claim, the net loss of the doctors in Ontario is 1,300. So the Ontario actually lost 1,300 doctors as opposed to gaining as the current government actually claims. So not conservatives for me. Second leading party is Liberals. They have a chance to win, and they have sort of reasonable proposals to some degree. So they propose to spend about $10 billion on healthcare. They want to find over 3,000 family doctors, and they want to expand OHIP, which is government pay insurance, to include psychotherapy. Paying private providers for psychotherapy. So maybe it's going to cost $10 billion. I'm not sure. I'm not the economist. But what I do know is that doctors and nurses don't appear from the thin air. So right now, there is about 40,000 doctors in Ontario. So 3,000 is actually a big number. So it is about 25% of all family doctors. So they need to add 25%, and they don't have these family doctors. It's not like the doctors are sitting somewhere waiting for the government to throw money at them. So it will be difficult to do. At the same time, we have about 13,000 international medical graduates in Ontario. Well, yours truly is one of them. But so technically, we could hire the doctors from this pool, simplify licensing procedure so it is easier for them to get started. But based on my experience, I know that when I went through the residency program, although it was a bit painful, I actually learned a lot. I learned about system, the communication within the system, the appropriate boundaries. So when people come from different cultures, from different parts of the world, they actually need special training to understand how the system works, because even if it is similar, it is still different. So it's going to take time. And to train new doctors, you need to use current doctors. So then the shortage is going to get worse before it starts getting better. So another problem also related to staff is if Liberals expand the psychotherapy program and include private providers, they're going to need about 13,000 new providers. That is actually at least double. Maybe they're going to need even more to cover all the needs. So if the program is too restrictive, like, for example, in BC, then, of course, people won't get psychotherapy, but then it would just defeat the purpose of the policy. They have some ideas how to expand emergency rooms, but yet again, the problem is the staff, not the buildings. Again, government, they offer to build, but the buildings are not the problem. There's a lot of buildings. People is the problem. And the people also burn out. So about 40% of nurses and doctors say they're burning out. They want to cut the working hours or maybe leave the field altogether. And none of the parties really address the burnout issue. So we spoke about conservatives and liberals. So next on line is New Democrats. So they're socialists. So of course they want to include as many people as possible. So and they propose something very similar to Liberals in this regard. So they propose to also spend about $10 billion, find over 3,000 doctors, and include psychotherapy, which is great. I wish we have the system, and I wish we had money. We just don't have enough people. So when you listen to the politicians, take it with a grain of salt what they promise. They say they can do this, they can do that, but like in reality, it may not be possible. So the last leading party is Greens. they really don't have much of a chance of winning majority government. Actually, not at all. But I like their platform because they have more holistic approach. They don't just want to throw money at psychotherapy or emergency rooms or like hire new doctors. They actually try to address other aspects of mental health and healthcare in general. For example, affordable housing as a part of healthcare and mental health, and other determinants, social determinants of health. And of course, if I don't have a roof over my head or a shelter, then my mental health is probably not going to be in a very good condition. Another important point is pharmacare. None of the major political parties talk about it, but a quarter of Ontarians cannot afford to pay for their medication. So they go to see their doctors because it is covered by OHIP. They take the prescription, they go to the pharmacy, but they realize they cannot pay for it, so they don't even fill the prescription, but they already have a follow-up appointment, so they're going to go to see their doctor, and they probably feel ashamed that they cannot pay for the medicine, so they're going to tell the doctor everything's good, they take in medicine, but they're not getting better. So the doctor is burning out, they feel inadequate because they cannot treat their conditions, the patients feel ashamed that they cannot afford their medicine, and they keep coming back for more and more appointments because that's what is covered, but they're not getting better. So, and guess how many doctors we need? We need about 25% more doctors. So essentially, if the government covers the medication for those people who cannot afford it, then they would not be coming back to see their doctors so often, and about a quarter of the appointments may become available to those who actually don't have a family doctor at all. The bottom line is, I think elected politicians need to be punished for their lies. I'm not sure who I'm going to be voting for. I would prefer to vote for Greens. I think they have a nice holistic approach, but to improve chances of toppling conservative government this time, I think I'm probably going to be voting for Liberals. You vote whoever you feel like, but keep in mind that you can't really trust politicians. You have to read the policies and understand it for yourself. Thank you very much. Come back for more.